Welcome to a deep dive into the fascinating world of oral health. And get this, it's personalized just for you.
Oh, wow. Personalized oral health. I like the sound of that already.
Right. We're going to be exploring some really cool excerpts from A Guide to Dental Care across all ages. It features insights from 13 dentists from Taipei Medical University.
13 dentists. That's a whole lot of dental expertise.
It is, and we're going to try to distill all that wisdom down into something you can actually use in your everyday life.
Sounds like a plan.
So our mission for this deep dive is to really equip you with the knowledge to not only maintain your oral health, but also make informed decisions about your dental care because, let's face it, there's a lot of confusing information out there.
Absolutely. And sometimes it feels like everyone has a different opinion about what's best.
So true. And one thing that really jumped out at me right away is the fact that the WHO, the World Health Organization, ranks tooth decay as the third most prevalent non-communicable disease globally.
The third. Wow, that's huge.
I know, right? It's right up there with cardiovascular disease and cancer.
That's a pretty startling statistic, and it really emphasizes how crucial oral health is.
It does. And I think a lot of times we think of oral health as just, keeping our teeth white and having a nice smile, but it goes so much deeper than that.
You're absolutely right. We often think of it as separate from our overall health, but it's really deeply interconnected. Poor oral health can impact your entire body, not just your mouth.
Exactly. And, speaking of that connection, did you know that the bacteria that causes gum disease can actually enter your bloodstream?
Yeah, that's right. And research even suggests that it could contribute to heart disease.
That's a bit scary to think about.
It is, and there's also a potential link to Alzheimer's, which is fascinating.
Alzheimer's. Really?
Yeah. The idea is that chewing actually stimulates the brain. So if you have fewer teeth or you have oral health issues that make it difficult to chew, it could actually increase your risk of cognitive decline.
Wow, that makes you think twice about, taking good care of those teeth.
It definitely does.
And speaking of taking care of teeth, this book really dives into how we can protect our oral health at every stage of life, starting with babies.
Oh, that's so important. Those early years really set the stage for a lifetime of good oral health.
They do. And, one thing that surprised me is that even babies who only drink milk need oral hygiene.
Yeah, that's a common misconception. A lot of parents think that if their babies don't have teeth or if they're only drinking milk, they don't have to worry about cleaning their mouths. But that's not true at all.
So why is that? Why is it so important to clean a baby's mouth even before they have teeth?
Well, even before teeth emerge, cleaning a baby's gums is really crucial to prevent something called baby bottle tooth decay.
Baby bottle tooth decay, what's that?
Basically, it's caused by milk sugars sitting in the mouth for too long, and it can actually cause those little baby teeth to come in already decayed.
Oh no, that sounds terrible.
It is, and it's actually more common than you might think.
So how do you even clean a baby's mouth before they have teeth? I mean, it seems like it would be quite the challenge.
The book recommends using gauze for infants and then switching to a soft-bristled, small-headed toothbrush when more teeth start to emerge.
Okay, that makes sense. So gauze at first and then a soft toothbrush when those teeth start popping up.
Exactly. And they even describe this interesting knee-to-knee positioning technique for parents to make cleaning easier.
Knee-to-knee. I'm picturing like a human baby car wash.
Kind of. So, you'd have like you and another person sitting knee to knee and babies laid across your laps, and it helps to stabilize the baby's head for easier cleaning.
That's actually a clever trick.
It is, and it can make a big difference, especially if your baby is, a little bit wiggly.
Yeah, I can imagine. And speaking of babies, let's talk about teething for a minute, because I know that can be such a tough time for both babies and parents.
Oh, it definitely is. It's one of those milestones that's both exciting and a little bit dreaded.
So true. So the book has some tips for soothing those sore gums, right?
Yeah, they highlight chilled vegetables as a great option because the coldness can help to numb the pain. And they also recommend gentle gum massage.
Gentle gum massage. Okay.
Yeah, and they also dispel the myth that fever is a direct result of teething.
Oh, really? So a fever doesn't necessarily mean the teeth are coming in?
Not necessarily. Usually a fever during teething is caused by the baby putting things in their mouth, which can lead to infection.
Okay, that makes sense because everything goes in the mouth at that age.
Exactly. And, their little immune systems are still developing, so it's easy for them to pick up germs.
Yeah, that's a good reminder. And what about fluoride toothpaste? There always seems to be a lot of debate about when to start using it.
The book recommends a pea-sized amount for children 2 years and older.
2 years and older, okay.
Yeah, and they emphasize the surprisingly low risk of fluoride toxicity from swallowing toothpaste.
Really? I feel like a lot of parents worry about that.
They do, but the book really stresses that the amount of fluoride in toothpaste is very small, and the benefits of using it far outweigh the risks.
Okay, so fluoride is a good thing overall.
It is. It's really one of the most effective ways to prevent tooth decay.
Good to know. And another thing that a lot of parents worry about is nutrition. Making sure their kids are getting enough calcium and all that good stuff.
Yeah, so is it true that calcium supplements are essential for strong teeth?
That's a good question. And actually, the authors of the book emphasize that balanced nutrition from natural foods is key. Okay, so real food over supplements.
Exactly. And they say that supplements should only be used if medically advised.
Makes sense. And what about the whole chewing and swallowing thing? How does that play into it?
Well, the book talks about how important it is for babies to develop those chewing and swallowing skills early on. And they encourage parents to introduce semi-solid and solid foods, once the baby is ready, of course, to help exercise those jaw muscles.
Because we're basically giving those little jaw muscles a workout from the start.
Pretty much. And it's important because strong jaw muscles not only help with chewing, but they also contribute to proper speech development.
Wow, so many things connected to those tiny mouths.
I know. It's amazing how much is going on in there.
Okay, so we've covered a lot of ground with babies, but let's shift gears a bit and talk about preventing tooth decay in slightly older children, once they've got a full set of those baby teeth.
Sounds good. I'm ready to move on to the big kids.
So we all know that brushing is important, but the book really dives into the serious consequences of untreated decay in baby teeth. And this is something that I think a lot of parents might not be aware of.
You're right. There's a misconception out there that because baby teeth fall out, decay doesn't really matter.
Yeah, you hear that a lot, like, oh, it's just a baby tooth. It's going to fall out anyway.
Right. But the problem is that untreated decay can actually lead to some really serious complications like cellulitis and even sepsis.
Sepsis, wow, that's scary.
It is. Sepsis is a life-threatening infection that can spread throughout the body. And you wouldn't think that it could start with something as seemingly simple as tooth decay.
That's terrifying. I think most people don't associate tooth decay with something as serious as sepsis.
I agree. It's not something that's talked about a lot, but it's important for parents to be aware of the potential risks.
Absolutely. So what are some warning signs that parents should look out for?
Well, if you see any swelling, redness, or tenderness around the affected tooth, that's a red flag. And of course, fever and lethargy are always signs that something's wrong.
Okay, so keep a close eye on those little mouths.
Definitely. And another thing to remember is that tooth decay is contagious.
Wait, tooth decay is contagious?
It is. It can actually spread within families.
So if one kid has a cavity, their siblings are at risk.
Exactly. So it's really important to encourage family-wide efforts to improve oral hygiene.
So we're all in this together when it comes to fighting tooth decay.
We are. And, the book also talks about some preventative measures beyond brushing.
Oh, like what?
Well, they talk about the benefits of fluoride tablets and professional fluoride varnish application.
So like an extra dose of fluoride.
Exactly. And they also talk about dental sealants, which are basically thin coatings that are applied to the chewing surfaces of molars.
And those sealants help to protect the teeth from decay.
They do. They act as a barrier to keep food and bacteria from getting stuck in those little grooves and crevices.
It's like building a fortress around those teeth.
Exactly. And, the book also talks about the importance of teaching children about oral health and finding ways to motivate them to brush properly.
Because let's face it, getting kids to brush their teeth can be like pulling teeth.
It can be,
Yeah.
But the book has some good suggestions like using disclosing tablets.
Disclosing tablets.
Yeah, they're these little chewable tablets that stain the plaque on your teeth so kids can actually see where they've missed.
Oh, that's cool. So it's like a science experiment in your mouth.
Exactly. And kids love that kind of stuff.
Yeah, they do. All right, so moving on.
Huh?
I remember when my permanent teeth were coming in, and it seemed like my baby teeth were never going to fall out. And I ended up with this, awkward double row of teeth for a while. It was not cute.
Oh, yeah. I remember those days, too. It can be a little bit strange looking, but it's totally normal.
Okay, good, because I was a little self-conscious about it.
Well, the book actually addresses this common parental anxiety. They reassure parents that this double row situation is completely normal and that the permanent teeth will usually move into the correct position as the child chews.
Oh, that's good to know.
It is. But they also emphasize the importance of regular dental checkups during this time, just to make sure that everything's progressing as it should.
So even if things seem to be going smoothly, it's still important to see the dentist regularly.
Exactly. Early detection is key when it comes to oral health.
Makes sense.
Yeah.
Now let's talk about orthodontics, because that's something that a lot of people think of as purely cosmetic, like just straightening teeth to make them look nicer.
Right. But the book really paints a much broader picture.
Oh, how so?
Well, they explain how misaligned teeth or malocclusion can actually impact a lot of different things, like chewing speech, jaw pain, and even self-esteem.
Wow, I never realized it could be that serious.
It can. And according to the WHO, 7 out of 10 people globally have some degree of malocclusion.
7 out of 10. That's a lot of people.
It is. It's more common than you might think.
Wow. So what are the different types of malocclusion and how do they impact oral health?
Well, the book mentions crowding protrusion, deep bite, and open bite. And each of those can affect your ability to clean your teeth effectively and even speak properly.
So it's not just about aesthetics, it's about function too.
Exactly. And the good news is that orthodontics has evolved significantly over the years. Treatment can now improve not only appearance, but also function and overall well-being.
That's reassuring because I think a lot of people still picture those painful metal braces when they think of orthodontics.
I know, but there are so many more options these days, like clear aligners, lingual braces, which are hidden behind the teeth, and even accelerated orthodontics, which can shorten treatment time.
That's awesome. So it's not this like one-size-fits-all thing anymore.
Nope, there are a lot of different ways to straighten those pearly whites.
That's great news for anyone who's been putting off orthodontic treatment.
It is. And speaking of things we might not think about, the book also has a whole section on the importance of saliva.
Saliva? Really? I never thought of it as being that important for oral health.
Yeah, I know it seems kind of basic, but saliva actually plays a vital role in neutralizing acids, washing away bacteria, and even remineralizing teeth.
Wow, so it's like a multitasking superhero.
It is. It's your mouth's natural defense system.
That's incredible. So what happens when you don't have enough saliva?
Well, the book talks about dry mouth as a problem.
Okay, so dry mouth is bad news.
It can be. It's also known as xerostomia, and it can be caused by various factors like medication side effects, medical conditions like Sjogren's syndrome, and even just aging.
So there are a lot of different things that can lead to dry mouth.
There are. And the book emphasizes that effectively treating dry mouth requires identifying the underlying cause.
So it's not as simple as just drinking more water.
Not necessarily. Sometimes drinking more water can help. But if there's an underlying medical condition or medication side effect that's causing the dry mouth, you need to address that first.
Makes sense. And now I'm remembering something from earlier. We were talking about the connection between chewing and cognitive function.
Oh, right.
And the book revisits that concept and introduces this idea of oral frailty.
Yes, oral frailty.
Okay, so I have to admit, I've never heard of that before. What exactly does it mean?
Essentially, it's a decline in oral function that impacts your overall health and well-being.
So like not being able to chew or swallow properly?
Yes, exactly. Think about it. If you're having trouble chewing, swallowing, or even speaking clearly, it can affect your nutrition, your social interactions, and even your confidence.
Right. It's not just about your mouth anymore. It's about how those difficulties can impact your entire life.
Exactly. And that's what oral frailty is all about.
Okay, so what are some warning signs of oral frailty that we should be aware of?
Well, the book highlights a few key things, like difficulty swallowing, choking, food spillage, while eating, slurred speech, persistent dry mouth, and worsening bad breath.
So if you're experiencing any of those things, it's a sign that something might be off.
Exactly. And it's important to address it early on because oral frailty can actually lead to some serious complications like malnutrition and aspiration pneumonia.
Aspiration pneumonia, what's that?
It's when food or liquid enters the lungs, which can lead to a serious infection.
Oh, wow, that's serious.
It is. And it really highlights the importance of maintaining good oral health throughout our lives because as we age, these issues can become more common.
Makes sense. So we need to take care of those mouths now to prevent problems later on.
Absolutely. And it's not just about preventing disease, it's also about maintaining function and quality of life as we age.
That's a great point. We want to be able to enjoy our food and socialize without any discomfort or embarrassment.
Exactly. And that's why oral health is so important at every stage of life.
Exactly. And it's not just about, avoiding the dentist. It's about really living a fuller, healthier life.
I love that reframing. It's so true. And the book actually gives some practical advice on how we can actually maintain these oral functions as we age.
Oh, like what kind of advice? Well, one key recommendation that really stood out to me was to, continue challenging your jaw muscles by eating a variety of foods, including, those that require more chewing effort.
Oh, that makes sense. So no more switching to an all-soft food diet just because we're getting older.
Right, exactly. Those jaw muscles need to work out too, just like the rest of our body.
Use it or lose it, right?
Exactly. And the book also highlights the importance of those regular dental checkups. even if, we don't have any noticeable problems.
Oh, that's so important because sometimes problems can be brewing under the surface even if we don't feel them.
That's so true. And, those regular checkups can help catch those potential issues early on when they're, much easier to address.
Absolutely. Prevention is always better than cure.
Always.
Yeah.
And, speaking of prevention, let's talk about brushing, because I think a lot of people wonder if brushing twice a day is really enough to keep those pearly whites sparkling.
Well, brushing is definitely the foundation of good oral hygiene, but the book really emphasizes that it's only part of the equation.
Oh, so there's more to it than just brushing.
There is. You really need to use dental floss or interdental brushes to clean between your teeth. Where your toothbrush can't reach.
Okay, so it's like a tag team effort.
Mm-hmm.
The toothbrush tackles the surfaces and the floss gets into those nooks and crannies.
Exactly. That's a great way to put it. And, the book actually goes into a lot of detail about choosing the right tools, too, like when you're picking out a toothbrush.
Oh, really? So, like, what should we be looking for?
Well, they recommend opting for soft bristles.
Yeah.
A small head and straight, rounded bristles.
Okay, so soft, small, and straight.
Mm.
Got it. What about those electric toothbrushes? Are they really better than manual ones?
The book says that both types can be equally effective if they're used correctly.
So it's really all about the technique.
It is. The key is proper technique and consistency.
Makes sense. So no matter what kind of toothbrush you're using, you got to make sure you're using it right.
Exactly. Brushing like you mean it.
Now let's talk about toothpaste, because, oh my gosh, there are so many options out there. Whitening sensitivity protection, gum care. How do you even know which one is right for you?
It can be overwhelming, right, walking down that toothpaste aisle?
It is. I just stand there and stare sometimes.
Well, luckily this book actually breaks down the different types of toothpaste and their intended uses.
Oh, that's helpful. So, like, what about fluoride toothpaste? I feel like we hear a lot about that.
Well, the book reiterates that fluoride toothpaste is absolutely crucial for preventing tooth decay.
Okay, so that's a must-have.
It is.
Yeah.
And then they also talk about sensitivity toothpaste, which can be really helpful if you experience, discomfort from exposed dentin.
Oh, yeah, that sharp pain when you eat something cold.
Exactly.
Yeah.
That sensitivity, and there's special toothpaste that can help to block those sensations.
Okay, so fluoride for prevention, sensitivity for relief.
Got it.
What about those whitening toothpaste? Do they actually work?
Well, the book kind of cautions against relying solely on whitening toothpaste for a brighter smile.
Oh, so they're not miracle workers?
Not quite. While they can help to remove surface stains, they don't actually bleach your teeth.
So if you want, like, seriously white teeth, you might need to go the professional route.
Exactly. Professional whitening treatments can be much more effective.
Good to know. And while we're on the topic of all these oral hygiene products, what about mouthwash? Is that like a necessary part of a good oral care routine?
The book considers mouthwash to be more of an optional add-on, not a replacement for brushing and flossing.
Okay, so it's not a deal breaker.
Not really. It can definitely freshen breath and, reach areas that are difficult to clean with a toothbrush or floss, but it shouldn't be a substitute for those essential practices.
Got it. So mouthwash is like the backup singer, not the lead vocalist.
Perfect analogy. I like that.
Okay, now let's talk about something that often makes people cringe dental visits, and specifically those dreaded teeth cleanings.
Oh, yeah. Those can be a little bit nerve-wracking.
They can, but the book dedicates a lot of space to explaining why regular cleanings are so important. They actually call them dental scaling.
Dental scaling,
Yeah.
huh?
Yeah. It sounds a lot more intense than just a cleaning.
It does, but it's basically the same thing. And the book explains how if you don't get those regular cleanings, the plaque on your teeth can actually harden into tartar.
Tartar, that sounds bad.
It is. Tartar is basically like this super stubborn plaque that can only be removed by a dental professional.
Oh, so that's why we can't just, scrub it off ourselves.
Exactly. And regular cleanings prevent that tartar buildup, which can then lead to gum disease and other oral health issues.
So those cleanings are about more than just, making your teeth feel smooth. They're about preventing serious problems down the line.
Exactly. They're an investment in your long-term oral health.
And, the book actually addresses some common concerns about cleanings, like whether they can make your teeth more sensitive or cause your gums to bleed.
Oh, yeah, I've definitely heard those concerns before.
Me too. So what does the book say about that?
Well, they explain that any sensitivity or bleeding after a cleaning is usually temporary.
Okay, so it's not like a permanent thing.
No, it's usually just a result of removing that tartar buildup, which can irritate the gums.
So in a way, it's a sign that the cleaning was necessary.
Exactly. Those gums are getting a fresh start.
I like that way of thinking about it. Okay, so we've talked a lot about preventative care, but let's circle back to orthodontics for a minute, because I think there's still a lot of confusion
Yeah.
about, what it is and who it's for.
Yeah, you're right. A lot of people still think of it as just, straightening teeth for cosmetic reasons.
Exactly. But we know from the book that it's much more than that.
It is. The authors really emphasize how malocclusion, misaligned teeth can lead to all sorts of problems like chewing difficulties, speech problems, and even jaw pain.
And we can't forget about the psychological impact, too.
Absolutely. They talk about how misaligned teeth can contribute to self-consciousness and low self-esteem, especially in children and teenagers.
It's amazing how the alignment of your teeth can have such far-reaching consequences.
It really is. It's all connected.
And speaking of things we might not think about, the book also has a whole section on the importance of saliva.
Saliva, the unsung hero of oral health.
Seriously, I never thought of it as being that important.
Well, it's easy to overlook, but saliva plays such a vital role in keeping our mouths healthy.
Like how?
Well, for starters, it helps to neutralize acids in the mouth, which protects our teeth from decay.
Okay, that makes sense.
And it also washes away bacteria and food particles, which helps to keep our breath fresh and prevent plaque buildup.
Wow, so it's like a natural mouthwash.
Exactly. And it also helps to remineralize our teeth, which strengthens them and makes them more resistant to decay.
So it's like a multitasking superhero.
It really is. And the book does a great job of explaining all the amazing things that saliva does for us.
Okay. But what happens if you don't produce enough saliva?
Well, that's when you start to experience dry mouth, which the book also talks about.
Right. Dry mouth, also known as xerostomia.
Exactly. And as we mentioned before, dry mouth can be caused by a variety of factors like medication side effects, medical conditions, and even just aging.
So it's a pretty common problem.
It is, and it's important to take it seriously because chronic dry mouth can lead to a whole host of other oral health issues.
Oh, like what?
Well, for one thing, it can make it harder to chew and swallow because your mouth isn't properly lubricated.
That makes sense.
And it can also increase your risk of tooth decay because saliva helps to neutralize those harmful acids.
So dry mouth is kind of a double whammy.
It can be. And it can also affect your sense of taste and make your breath smell bad.
Not fun.
Not at all. So if you're experiencing dry mouth, it's important to talk to your dentist or doctor to figure out what's causing it and get the appropriate treatment.
Okay, so dry mouth, not something to ignore.
Definitely. And speaking of things we should be paying attention to, the book also revisits that connection between chewing and cognitive function.
Oh, right. We talked about that earlier.
And they introduce this idea of oral frailty, which we touched on briefly before.
Oral frailty. Yeah, I'm still not quite sure what that means.
It's basically a decline in oral function that can significantly impact your overall health and well-being.
Okay, so it's more than just not being able to chew properly.
Exactly. It's about the broader impact that poor oral health can have on your life. It can affect your ability to eat, speak, socialize, and even maintain your independence.
Wow, that's a pretty sobering thought.
It is, but it's also a reminder of how important it is to prioritize our oral health.
Absolutely. So what are some signs of oral frailty that we should be looking out for?
Well, the book outlines a few key things like difficulty swallowing, choking food spillage while eating, slurred speech, persistent dry mouth, and worsening bad breath.
So those are all red flags that something might be amiss.
They are, and if you're experiencing any of these symptoms, it's important to talk to your dentist or doctor to get checked out.
Because as we learned earlier, oral frailty can lead to some pretty serious complications.
Exactly, like malnutrition and aspiration pneumonia.
So it's definitely not something to take lightly.
No, it's not. And, the book ties all of this back to that Japanese goal of 80-20.
80-20, right? Having 20 teeth at age 80.
Exactly. It's a reminder that oral health isn't just about preventing disease. It's about maintaining function and vitality as we age.
I love that. It's not just about avoiding the dentist. It's about living a fuller, healthier life.
Precisely. And that's what this book is all about, empowering us to take control of our oral health so we can enjoy all the benefits that come with a healthy mouth.
And I think that's a perfect message to end on. Thank you so much for taking us on this deep dive into the world of oral health.
It's been my pleasure, and remember, a healthy smile is a reflection of a healthy life.
Wow, that's a powerful realization. It's like a whole new way of thinking about oral health.
It really is. It makes you realize that even small changes in our daily habits can have a big impact on our mouths. Like, for example, could cutting back on sugary drinks lead to healthier gums? Could managing stress reduce inflammation in the mouth? These are all questions worth exploring.
Absolutely. It's all about those connections, isn't it? Seeing the bigger picture and understanding how everything is intertwined.
Precisely. And this book, even though it focuses on specific dental care practices, really lays the foundation for that broader understanding. It's not just a guide to oral hygiene, it's a guide to a healthier life.
So well said, and I think that's the perfect note to end on this. Deep dives into oral health has been incredibly eye-opening, and I feel like I have a whole new appreciation for the importance of taking care of my mouth.
Me too. And remember, it's never too late to start making those positive changes. Even small steps can make a big difference over time.
So true. So if you're feeling inspired to take charge of your oral health, I highly recommend scheduling a dental checkup soon. Those regular visits are crucial for catching any potential problems early on and getting personalized advice from a professional.
Couldn't agree more. And in the meantime, just, pay attention to your daily habits. How might they be impacting your oral health? Could making small adjustments lead to a healthier mouth and a healthier you? These are questions worth pondering as you continue on your oral health journey.
I love that advice. Thanks for joining us on this fascinating deep dive into the world of oral health. Remember, a healthy smile is a reflection of a healthy life.